Hello and welcome to the ASTHO and NACCHO combined closed pod survey webinar. I'd like to welcome you on behalf of ASTHO and NACCHO and CDC as we present the results from the closed pod survey that was done last year. We will be having a presentation by Commander Adam Lofton, Raymond Purini, and Dr. Donna Batt. Following, we'll have a question and answer portion, which will be run through the operator. Our first presenter, Dr. Adam Lofton, is a current public health advisor with CDC's Strategic National Stockpile. He serves in the Community Resilience Activity, which helps facilitate external partnerships to assist state and local public health response planning. He has been with CDC since 2004 and has worked primarily as an MCM expert in both DS&S and the Division of State and Local Readiness. Our next presenter, Raymond Purini, is a senior analyst with NACCHO, and Dr. Donna Batt is the Deputy Chief of Healthcare Preparedness Activity with DS&S. She also serves as a captain in the U.S. Public Health Service. Adam, I'll turn it over to you.
Okay, thank you so much, Meredith, and thank you all for joining us today. We have quite a bit of information to present to you, and it's probably been long awaited, so we're excited to be able to have this conversation with you. I would like to also mention that both Natalie Sanchez and Claudia Marone of the Division of State and Local Readiness are also on the line today to help answer questions you may have as we navigate the slides for today. But to get started, we are going to be talking about several pieces of a survey that many of you may be familiar with. Back in 2013, there was a survey that ASTHO had submitted, and there was some facilitation with the Division of Strategic National Stockpile. In those days, Afike Kambui, you may remember, was working with us to really look at the use of closed pods, and so we're going to be talking about the survey analysis from that time. And then subsequent to that, there was some additional questions that NACCHO asked, and some particular that involved the healthcare sector and healthcare preparedness activity also at CDC. And so you're going to get to hear some about that as well in the following slides. And then we have some next steps, some key findings, and way ahead that we feel may address some of the concerns and the issues that were brought up from the survey analysis itself. So just in an introduction, as I mentioned, this is timely because we've had a lot that's happened since November 2013. But I do need to preface that this was an ASTHO survey that CDC was asked to help be a part of, and certainly we were very interested in the results, and we've been asked to facilitate this. But this is between ASTHO and NACCHO, not a CDC-led event. The survey did consist of 20 questions. We're going to be going through those in a summary kind of way today, and some of the high points that resulted from the survey that was conducted. It is specific to closed pods and the planning and operational aspects of the utilization of closed pods, and we're defining that as private and public locations that have entered into an agreement with public health to dispense medical countermeasures. So getting into the initial aspect of this survey, so again, the ASTHO portion of this slide helps you to see the number of respondents. There were originally 358 total respondents to the survey. The breakdown there shows about 82 state health departments. 4 of the territories participated. 268 of the people were from local health departments and 4 from directly funded cities. But of those, about 86% actually used closed pods. So if you didn't use closed pods, then there was really no reason to continue on in the survey. So the breakdown there at the bottom shows the number that actually completed the survey for a total number of about 308 participants. And as I mentioned, there's the breakdown of which category, which type of department that the participants were coming from. So just to kind of go through some of the questions, and I'll do this rather quickly. I think most of the slides kind of speak for themselves, but one of the primary questions that we were interested in was what type of agreement does your jurisdiction use when you're entering into a relationship, a partnership with a closed pod. And roughly 3/4 have some sort of written agreement, an MOU or an MOA. About 31% said a verbal agreement. I can tell you we found that a little bit interesting. I'm sure we would like to hear more from some of you that have that kind of agreement in place, and then how solid or concrete you feel that is in terms of being able to rely on an agreement that's only verbal during an emergency response. 22% had some sort of enrollment form, and 12% actually had some sort of contract. The next question we looked at, and we break these out by local health jurisdictions or departments, and then you'll see the follow-on slide will have the state and territorial. But the importance of each of these sectors, and when you're looking at who you want to target for a closed pod, here's the various sectors and by their level of importance you place in trying to plan for. Healthcare for the local health departments was right at the top. As you can see, the very important is the farthest to the right and not as important to the left. So all of these sectors were deemed as at least somewhat important, but with healthcare and government, academia, some of those type of industries we're maybe a little more familiar with from public health, whereas private business and community organizations and so forth we're maybe less familiar with and entering into those agreements and relationships. Military, there might be a reason it's deemed less important, as many local health districts may not have a large military presence or base in their jurisdiction. So the same question for state and health departments. Also healthcare, government, and academia were up at the top, but military was quite a bit higher there, and that's probably because most states have some sort of military presence, National Guard, or maybe a large base or so forth in their state. And then faith-based organizations, which ranked a little bit higher on the previous slide, was a little bit less important at the state level. And there's probably some reason for that with most churches and organizations of that nature really residing at the local level. So some of that's probably a bit intuitive. The next question is, what percentage of your planning jurisdiction's population is covered by your closed pod agreement? So as opposed to the plans you have for your traditional dispensing efforts that we've been doing for a long time, the population that serves versus using an alternate modality such as closed pods. And here it breaks down, the blue that you see is the current population that's covered by closed pods. Really topping out territories, more than 1/3 of their population is currently served by closed pods. But across the board, at least 20%, which is very encouraging. And then the green portion there is talking about the plans that are in place that are leading towards where you would like to be if the agreements and everything come to fruition to really expand this infrastructure and use closed pods to service more of your population for medical countermeasure dispensing. So on the next question, we ask you to rate the difficulty that your jurisdiction has with recruiting closed pod partners from the different sectors below. So you see at the bottom, the far left is very easy, ranging out to very difficult. And the leader there was private industry and business. And if you recall from the previous slide, it was one that was a little bit more difficult to navigate the agreement process and so forth. And so that's something that we see as kind of intuitive here from the survey. So across the board there, most are falling in kind of the middle range there. We say neutral, but somewhere between difficulty and easy in terms of recruiting these type of partners. And then for the state and territories, some similar things here. Faith-based was up at the top again for state health departments and territories. So there might be some lessons learned there to rely maybe on some of the local efforts if there are faith-based organizations that the state is really trying to make headway into getting some closed pod agreements. But again, just kind of going back and looking, healthcare was considered the easiest at both the local and the state level. Those three there, government, academia, and healthcare, which has a correlation to the slide we presented earlier, seem to be the least labor intensive, while private industry and faith-based tends to be a little bit more difficult. We also ask you to look at the top 3 challenges that you've experienced in recruiting and planning with closed pod partners. And so what this slide does is it takes some of the items that we listed as a type of challenge, and it shows the percentage of respondents. So the number 1 chosen challenge was legal and liability concerns. We've heard, throughout all of the time that we've been doing reviews and assessments, we've heard that this is something that is difficult, and CDC's done some work in trying to address those type of issues, but certainly more is needed with technical assistance and otherwise to address this. Then the next 2 there really speak to staffing, and we know that this is also very difficult. Staff at the health department to support not just the original relationship building with the closed pod, but with sustainment, training, all of those things. And then staff at the partner itself being able to meet all the expectations that state or local public health may need. Finally, their socialization to the partners about what is really needed and why there is a great benefit to being a part of this kind of a program with public health. And then difficulty in finding the right avenue, the right person or representative to make headway with a particular organization that you're concerned with. Again, the next couple of slides that differentiate between the local health departments and the state and territorial. Please indicate the level of effort required for the following aspects of closed pod planning and recruitment. So this is rating this on a scale of not labor intensive to very labor intensive. And you see here on the left column the type of activities. All of them are rating as at least somewhat labor intensive. Exercising closed pod plans, recruiting the partners, training, the continuing engagement, which really speaks to the maintenance and if you have a closed pod partner that is part of your plans, making sure that they're staying engaged in a way that they'll continue to be able to provide everything that was agreed upon. And then the development of specific plans. This is something that we know requires a lot of effort, at least initially, and then finally there the negotiating the written agreement. So all of these, as you can see, do range in somewhat labor-intensive task by our respondents. On the state side, most all of these were very similar. You can see here, I'm not going to go into too much, but this is an area that state and local seem to have quite a bit of agreement on. I think that the negotiating written agreements piece that was here on the local had it as a little less labor intensive, and on the state and territorial it was maybe a little more, so there might be some lessons learned there. Locals have maybe a little bit more access to the familiarity with their community, and that might aid the ability to establish some of those written agreements. But nonetheless, some similarity there in the responses. The next couple of slides, we talk about, do you have something or not? And here we're talking about, does your jurisdiction have closed pod marketing materials, how you are using these things to target and recruit your closed pod partners. So 3/4 of the state and territorial health department said yes, while about half of the local health department said yes. So some implications there, some maybe sharing that's needed and so forth to bring that number up a little bit. And then within that, the type of tools that are used, and you see here at the across this blue top row, different types of planning tools: guidance for setup, plan template, medication forms, and fact sheets. All of those things are really kind of the guidance written type of things. And for both state and local health departments, the majority have some form of those. For facility walkthrough, which is more of an operational activity, it drops a little bit, but it's still something that is considered fairly high on the list of things that are in place. And then when we start talking about supplies and go kits, which are a little bit more resource intensive, cost of maintaining that, cost of initial purchase and acquisition, those are a little bit lower in terms of departments having those already in place. And then when we talk about, do you provide closed pod training to your partners at the state and local, or the state and territorial level, 79% of the respondents said yes. Dropped a little bit at the local health department level. Again, probably staffing, resources, and so forth, but still the majority do provide training to their closed pod partners. And then when we talk about type of training, the overwhelming majority for both state and territorial as well as local health was in-person training, while roughly 16 to 20% had some sort of online or digital type of training that was provided. And we expect that that's also somewhat from lack of resource available. But some of these, especially when we're discussing the initial outreach and what's needed to really get the buy-in from the closed pod partner, it often requires some in-person training, and we're sensitive to that. And would a nationally standardized online closed pod training program be beneficial? Again, the overwhelming majority said yes for both state, territory, and local. So that is something that you'll see in the key findings. Does your planning jurisdiction provide any of the following exercise opportunities for your closed pod partners? And so here we have a list, and state and local public health led exercises, 3/4 said yes that they do that. And then some of these others are a little bit less. Support for individual partner exercises, a little less than half. Cross-jurisdictional exercises. Many of the closed pods that exist across the country may carry over into other jurisdictions, and so the ability to test that is something that is quite beneficial, but more resource intensive, and so you see the numbers here that have dropped a little bit there. Templates for partner-specific exercises, and then other exercise opportunities, still smaller percentages. The type of exercises that are most often performed, tabletop exercises and drills, the largest number there. And that's kind of what we would expect given time that's needed to perform, funding, and so forth. And then you see the rest of the breakdown there between functional, full-scale, and other types of exercises. So the key takeaways, the summary of a lot of this is that it's quite clear that closed pods continue to be a paramount piece of planning that both state and local jurisdictions are looking at using to force multiply, to take a lot of the demand off of their traditional pods that they've been planning for in schools and using public or volunteer staff. That the closed pod type of agreements continue to be a very attractive method for dispensing in jurisdictions across the country. Roughly half of the jurisdictions who are not currently using closed pods or have challenges, they attribute that to a lack of resources. And that's something that seems also a little bit intuitive and things that we need to look at as addressing holistically. Recruiting closed pod partners is labor intensive. There can be quite a bit of time spent in the marketing of this and the analysis of who to target and how we select. Legal liability issues, as we mentioned, that is something across the board was deemed as a concern or a challenge for public health and dealing with, I would expect with business partnerships primarily, they often will have a lot of questions and concerns about the legal ramifications of participating in something. And then most pod exercises are tied to public health exercises. As we mentioned, more on the tabletop discussion type of things, but do include some operational exercises. And really, if we are expecting to utilize a closed pod partner, at some point we want to see that operational demonstration to have faith that they will be able to perform for that segment of the population that we're planning for. So while those were some of the summary statements from the responses, some of the takeaways that we, in looking at this, can suggest that could help and really benefit locals and states across the country in planning for and dealing with these issues, is that national templates can be created for recruitment materials. We've delved into this in the past, and this is certainly an area that we're looking at right now at CDC, and I'll talk a little bit more about that towards the end of the presentation. But we can also use existing national data where there are exercises or there are other opportunities to gain and analyze data. We can use that to help state agencies, local health departments, and others to identify the closed pod partners that can really be of the biggest benefit in their jurisdiction. And then closed pod partners can be recruited and agreements can be facilitated at a national level so that we can provide a lot of that information that's already been drafted, templated, agreements in place to really ease the process at your level, especially when they're cross-jurisdictional partners, if it's regionally based outside of just a local jurisdiction, that what we can do to help facilitate that maybe at a national level could be of great assistance. And then certainly as we go through these things, that best practices can be not just research, but can really be articulated, messaged in a way to promote what the best solutions for dealing through some of these issues are. So I realize that was rather quick. I wanted to go through the slides of what the responses to the survey were. The full report of the survey can be found here at this website. So this is an opportunity for you to really look at every single question that was asked and the data and the responses that came through. But we do have some more to talk about and summary and what we're doing at CDC. And so before we get there, I'm going to go ahead and turn it over to my colleague, Mr. Ray Purini, and he's going to talk a little bit about NACCHO and how they also looked at some of these similar issues with respect to closed pod on their survey. So Ray, I'm going to turn it over to you.
Thank you, Adam. Hello, everyone. My name is Raymond Purini from the National Association of County and City Health Officials. I am a senior program analyst here at NACCHO who works primarily on projects related to medical countermeasures in the Strategic National Stockpile. So I'm just going to talk a little bit today about the brief survey that we did following this larger survey that was done earlier last year to really look at the specific needs that state and local health departments had with respect to the resources and the training tools that that they needed to further closed pod plannings in the jurisdiction. So CDC was really interested in trying to figure out which resource needs there were with respect to specifically to healthcare organizations. So although the larger survey looked at closed pods as a whole, this survey was more in tune with just the needs of healthcare closed pod planning. So working collaboratively with Oak Ridge, Associated University, CDC, and ASTHO, NACCHO developed a survey to help inform a toolkit that CDC would be developing over the course of the next year or so that might include tools, resources, and training that would be helpful with pursuing closed-pod partnerships. Let's see. So once the survey was finalized, it was issued to the ASTHO Medical Countermeasure Steering Committee and the NACCHO Medical Countermeasure Work Group, both who are comprised of subject matter experts from their respective levels of governance. In total, it's a much smaller survey than this initial survey, with only about 30 participants answering about a 7-question survey. So I'll just get into some of the findings really quickly. So operational plans were among the most useful resources that were identified to both initiate and sustain closed-pod partnerships, and were also rated as providing the most potential benefit as tools to develop for this toolkit. Training materials were also indicated as being needed to initiate and sustain closed-pod partnerships, and were also ranked highly as providing the most potential benefit for tools to be developed. Access to tools via the web was also noted as being needed as well. Not listed on these options was also something mentioned that national level MOUs would be useful in helping to initiate and sustain closed-pod relationships with some organizations that might be larger, across a national organization who might have locations around the country. So that was also a finding that was indicated as a resource need, is pursuing larger national level agreements so that it would be easier for states and locals to approach some closed pods in their jurisdictions. We also looked at ways that states and locals would like to access developed resources that were going to be created. Users indicated that open access websites would be preferred over websites that required a login, such as a SharePoint, and that in-person training would be of more benefit as opposed to training that was done online. All right. As far as the particular training needs that were wanted by states and locals, among the most helpful training topics that were that should be addressed in this toolkit, operating and sustaining closed pods was among the highest rated needed topic. Structuring training for closed pods was ranked 2nd, and then engaging and recruiting closed pods was ranked 3rd. Among the CDC might also have capacity for their mobile training team to conduct trainings in the future for jurisdictions that might need that. So if their assistance was available, survey participants indicated that they would like those in-person training teams to conduct on-site closed-pod workshops as being the most highest ranked item, implementing regional closed-pod seminars, and then assisting with closed-pod exercises. All right, and then finally, let's see. The survey asked about addressing the highest ranked training platforms. So among those mentioned, let's see, Train the Trainer or Train the Leader was rated as the highest ranked training platforms. So having the organization's leadership being trained about the specifics of closed pod planning, and then going back to their organization to then train their staff and the rest of their organization about the specifics of closed pod operation, and then completing training steps themselves. Under that was also short online best practice vignettes, so highlighting best practices that have been used around the country at states and local jurisdictions to complete closed pod planning would also be another useful training need. And then also having planned, focused video conference discussions with subject matter experts on the line to help inform jurisdictions that might be needing specific might be having challenges in their jurisdictions, and seeing if there could be those experts could help inform how to overcome those challenges. All right. Let's see. And then finally, the survey ended with the greatest need for engagement strategies about how to engage with closed pods, and the best resources to help move closed pod planning along in jurisdictions. So among the listed choices that the survey participants had, they indicated that decision maker educational videos would be useful, partner engagement coaching calls, and then also partner recruiting, online negotiating, and training tips would also be useful as well. Another option that also survey participants indicated as being useful were, again, those establishing of national or international level agreements or MOUs with larger corporations. Would also be useful as an engagement strategy at a higher level to help then the states and locals engage closed pods at the local and state levels. So those are the findings in a nutshell, and I think the CDC is going to be talking about some of the next steps that they see coming out of these two surveys. So I'm going to turn it back over to, I believe, Adam or Donna.
Yeah, Ray, Captain Donna Botts will be following to talk specifically about the healthcare sector. So, okay. Donna?
Yep. Good afternoon, everyone. I just want to thank Meredith and Ray and Adam for inviting me to participate on the webinar and share some information with you all. Our group is the Healthcare Preparedness Activity at CDC, and we try to work to make sure that healthcare systems are effectively prepared to respond to emergencies. And to that end, we try to support public health, healthcare, EMS, as well as emergency management, working together to plan for and respond to emergency events. So our group got involved in looking at healthcare closed pods as a project, along with our ORISE partners who work closely with our team on developing projects and developing tools and resources about a year ago, I would say the summer of last year. And our goal was really to try to promote and facilitate closed pod planning and partnerships with community hospitals and healthcare partners by leveraging the existing initiatives at the, that are at the state and local level. As we saw in the survey that Adam went over those results, healthcare sector was rated at the top as far as the most important as far as engaging that group for planning. But they were also rated as far as being pretty easy as far as being able to recruit and working with those with the healthcare sector as far as planning. So we thought that was, kind of a great sweet spot, but we were trying to figure out what could we do to help state and local efforts as far as increasing recruitment, participation, sustainment of the healthcare sector with closed pods. And so that led us to start working on a couple of things, and we looked at the results from that Ray shared related to the healthcare sector and closed pod planning, and a couple of the things stood out for us that we thought we may be able to provide some assistance. One was related to recruitment, another related to training, and other related to operational plans. Those were the top 3 rated resources that were a result of the information that Ray just shared with you all. So our first steps was to work with NACCHO and ASTHO and really to try to look and see what's already out there. There's a lot of good materials as far as promotion, operational plans, training templates that various states and local jurisdictions already have. So we started compiling some of those resources, got direction for some great practices at various states from the 2 organizations, NACCHO and ASTHO. And then we started looking at how do we start maybe templating some of these things or creating samples that others could use. From the recruiting part, we thought since public health is doing quite a bit, and once again looking at that easy to engage healthcare sector result of the survey, we thought our efforts might be best used focusing on the healthcare component. So how do we engage the healthcare sector? How do we outreach to them? How do we make sure that they're going to be effective partners in planning for a public health event? So related to the recruitment piece, we are working on developing just some standardized, and I say standardized in quotations because most things can be templated, but of course you have to make them amenable to your local situation. But what we're doing is drafting things like sample letters or fact sheets or brochures, as well as presentations, and pulling from those existing resources that we saw at the state and local materials that we gathered. So we're not starting from scratch, and then just trying to really focus from the healthcare perspective on how can we encourage the healthcare sector to participate as part of the benefit of being a community partner, but also from the continuity operations and making that business case as well. So some of our focus is on that. The second component was the operational plans. That was rated as one of the top 3 as far as resources that would be beneficial. And so Ray had referenced a toolkit that we're starting to work on. Once again, our approach has always been to engage, the state and local partners through ASTHO, NACCHO, and other healthcare organizations to help us as we draft these materials. So we've developed an outline that has gone through NACCHO and ASTHO review, and we're starting to work on some of the components of a toolkit, but hoping it would be something where it has templates for a healthcare entity to use as far as emergency response plans, as far as training templates, as far as outreach materials, as well as evaluation templates. As far as how do you evaluate what you're doing through exercises or just being involved in the local planning efforts. Related to training, which was the third most beneficial resource that was outlined, this is something that we thought might be useful, and once again on the healthcare side, having just-in-time training for them, job aids, some presentations that just familiarize them with what is a pod, what are the medical countermeasures, how do you set up a pod or what's involved with operating, what are some of the key considerations that you need to consider as you're engaging in this planning effort. And then, of course, keeping in mind all of the types of best ways to engage or to get the information out that Ray mentioned in that survey, such as in-person trainings or online best practices or webinars and video conferencing. And then lastly, this is something that we're involved in everything that we do, and just looking at ways to encourage coordination and integration, between public health and healthcare entities. One of the things that we're looking at, also based on the survey results, is, where would these things be housed? Are there places that are more amenable to folks accessing them than others? And not only public health, but also healthcare, being able to assess the tools and resources. And then looking at sharing information via various platforms, such as webinars or making presentations or doing in-person in-person or video conferencing. I think that's it. I'm going to turn it over back to Adam to close this out, but we're still in a pretty much early stages. We are working closely with NACCHO and ASTHO, as well as our partners in Division of State and Local Readiness and Division of Strategic National Stockpile to help as we continue to develop these materials in the toolkit and looking at best ways to get the information out and what's critical to include. So thanks for including me in the presentation.
Thank you, ma'am. So just to kind of summarize the way ahead, Captain Botts talked a lot about some of the specific toolkits and different mediums that they're looking at using with respect to the healthcare sector. And the community resilience activity in the Division of Strategic National Stockpile is also looking at some of the very same types of things for other closed pod partners, whether it's the business, private sector, whether it's federal agencies, military, academia. I mean, a lot of these things that were brought up in the survey. And so one of the things that we're really focused on in our group is looking at the recruiting of national corporations and community organizations and trying to leverage CDC at a national level to bring it in concert with local planning that that we hear from you that these are some interests you have at trying to develop these closed pod partners. So we're working about that in some pilot studies. We currently are doing a pilot with Walgreens, with Costco. We now have a new pilot that we're doing with Meals on Wheels. And how these things are organized is you take a group of us from CDC with selected local and state health partners and representatives from the national level entity of those organizations, and you work through a project management timeline with the objective is to create some standardized toolkits that really answer maybe 90% of what you would be trying to accomplish in your jurisdictions. The sample agreements, the sample concept of operations for how that organization would be used, a lot of the questions and answers that you may have that have already been documented during this pilot, training plans and lessons learned, and all of these things into a toolkit kind of fashion so that this can aid you in really expediting adding that partner or that type of partner. In other words, if the pilot was with a Walgreens, then maybe that type of plan could easily be extrapolated to other retail pharmacy and so forth. And so that's one of the ways we're looking at supporting a lot of the needs that have been addressed in this survey and are excited about and how we're organizing and managing these things currently. Another, you're probably all familiar with the executive order that the White House had put forward that obligates federal agencies to participate in dispensing activities and opening up that as another staffing volunteer pool. Well, rather not volunteer, I suppose, by that order, but that we are continuing to work as a liaison with those federal agencies. Much of this right now has been done in concert with FEMA and a lot of the UASI, that's the Urban Area Security Initiative, planning, the MCM planning meetings to see how these different agencies would be utilized. But having those conversations alone are allowing us to really open those doors and how to be made more accessible in your jurisdictions at the state and local level. And then from a kind of a strategic look, we're trying to establish what criteria do we need that really helps us target who we want to recruit. You know, what type of industry makes the best closed pod partner. And so those are some other things that we're also looking at doing and having available in a kind of more of a marketing campaign toolkit that closed pod partners could look at and then certainly at your level look at in terms of who it is that you desire targeting. And along those lines, we've felt that we really need to do something that helps to reflect this work in a way that translates easy to outside partners. Government and public health, we're pretty familiar with using terms like, you know, MCM or other response type language, but that doesn't always translate quite as well to the partners, especially the business community. And so we're currently looking at and have a lot of initial positive feedback about this process, but the development of a brand, a slogan that can be used in the type of marketing tools that we promote, that if an organization agrees to become a closed pod partner, then they're given access to an MCM alliance, if you will, that would have a very recognizable name and logo that would be a part of that process that they can recognize and identify with. And then along the lines of training and what we offer in that way, since that came up quite a few times in the survey, we want to point out that currently the Division of Strategic National Stockpile does offer pod training, closed pod training, both through the SNS preparedness course as well as the mass antibiotic dispensing course. Within the mass antibiotic dispensing course, it's one of the topics that can kind of be requested in one of the activities that occurs, but there is that subject matter that's already there. And then furthermore, there's an online closed pod training. There you see its considerations for closed pod planning, and that is scheduled to be released in May of 2015. So there has been work along those lines to help address some of these type of needs that were addressed in the survey. Furthermore, there's the various resources here that are in this the slide, the different web addresses that you can go to get and look at specific materials that have been developed and been housed within NACCHO and some of these other locations that we've all been a part of in the past. So at this point, it's 2:48. I thought that it would be good to have this time to open it up to questions. I do see that Mr. Reddick has had a question. Meredith, do I turn it back over to the operator to handle how the questions and so forth come in?
Yes, Adam, if you could hand it over to the operator, and if you do have a question, please press *1, and then I'll get you in queue for the audio questions.
Ladies and gentlemen, if you would like to register a question, please press star followed by the number 1 on your telephone keypad. If your question has been answered and you would like to withdraw your registration, please press the pound key. One moment for your first question. Our first question comes from the line of David Reddick.
Hi, this is for Raymond, particularly. Raymond, congratulations on that survey. My question has to do with whether you think the findings from that survey of healthcare would be fairly similar to findings from other segments of industry that might be closed pod host.
Hello, David. Yeah, I think it would be applicable to other organizations, especially the kind of items like, national level MOUs, some of the things that they mentioned. I think that would be definitely of value and applicable to other organizations that may have a presence nationwide. Facilitating those relationships at a higher level certainly would be useful to state and local partners as well. And I think that a lot of times healthcare partners probably have the same challenges that other organizations have with respect to accomplishing closed pod plannings, and I think that oftentimes state and local partners have those same challenges with similar challenges, although with healthcare partners there may be specific challenges that are unique to those organizations as well, such as healthcare partners have to manage surge and those kind of situations as well that some other organizations might not have. But I think generally speaking that these survey results could have some applicability to other kinds of organizations.
Thank you. Look forward to seeing you next week.
Again, if you'd like to register a question, please press star followed by the number 1.
Meredith, also, I noticed a couple of the questions about the slides being available. Can you address that for them?
Yes, we'll send an email based on the registration from the conference today about when and where the slides will be posted and the recording of the meeting as well.
Yep.
Please hold for your next question. Your next question comes from the line of Melanie Simons.
Yeah, hi. You may have discussed this, but I was wondering, are you all collaboratively going to create like a repository of resources for all of us, maybe on the SharePoint site? Because I am so interested in some of these closed pod training materials, and I would love to see those somewhere where we can all access them.
This is Adam. Thank you for that. I think that's absolutely the intent. With respect to some of the specific pilots that we're doing, we use the SharePoint and CDC Join as we're working through that pilot and the project management piece. And ultimately that would be something that we open up for all of the tools that are developed for others to be able to access. All of that we would be messaging through ASTHO and NACCHO, but subsequent to that in CDC Join, many of you are familiar with the MCM portal, and Natalie Sanchez is on the line today, and I'm sure that something we could easily add if it's not already there in template form yet is a repository for just what you're talking about. Natalie, is there already something like that that captures the closed pod resources that have been developed, or is that just something that we could maybe add to that?
So you're talking about a toolkit repository?
Yes.
Yeah, so we have on the SharePoint site, we have the ability to have one. We don't have massive quantities of several different toolkits in general. We could put, if there's something in particular that you guys want, yes, we could post it. That would be easy. Is the question to just have a repository of several different items? Or, because a lot of times we actually just link up with the NACCHO toolbox for a lot of the toolkits that Ray's group goes through.
Yeah, it would be nice to have some of the state resources. I'm not sure what's on the NACCHO website, but some of the national stuff and maybe some of these individual state resources would be really nice.
Yeah, so the idea is to definitely allow NACCHO to handle putting resources and promising practices on their toolkit. They have the internal staff to do that. If there's something in particular that you want us to include on the SharePoint site, we can, but it's usually things that are CDC, that are developed by CDC, like guidance and stuff. We actually don't have a toolkit repository on the SharePoint site.
And once these tools do get developed, this is Ray at NACCHO, we will be doing a lot of promotion to let people know that their tools are out there, where they're located. So we will, upon release, be doing lots of pushing of information to make sure everyone knows where they are located.
Okay, thank you.
Just one last piece to add to that. So as we complete a pilot, there'll be quite a big marketing push for the materials that were developed, and through ASTHO and NACCHO channels, but absolutely we'll be housing that in the CDC Join site and letting you all know where to find that. And I see a couple of questions here that were written in the chat. One from Ms. McReynolds about, is there a projected timeline on release of the toolkit, and do you anticipate doing any pilot projects at the local level, either integrating the toolkit or implementing the national partnerships at the local level? So the way that we are working with some of these pilots right now is we have national involvement from the corporate side. So for instance, with Walgreens, we have partners that are participating in the pilot from the corporate offices of Walgreens. But much of the work is being hashed out at various local health jurisdictions, and exactly how would they like to see that facility best used in concert with their response plans. So Walgreens has said, well, here's several things, for instance, that we believe that we could offer public health, and then the local public health looks at how they might integrate that into their plans, and ultimately it has to be tested and demonstrated. And as we get through that process, which you can imagine takes some time, we're targeting later in the calendar year to hopefully test and demonstrate some of this. And then the culmination of all of that would be packaged into a portfolio or toolkit, as we're calling it, and then that would be shared. And that is something that we could easily house, as Natalie mentioned, in the MCM portal, as well as other avenues. So it very much involves locals. And But at the same time, when we are marketing about these opportunities, as we did recently with Meals on Wheels, we went through the NACCHO blog and others to see about interested parties. So over time, more things like that will come up. And if you are interested in participating in something like that, then you just respond. We have here on the questions page this email address, dsnscra@cdc.gov. So if you have particular interest, maybe there's a sector you've been trying to break into or whatnot, and you have interest in exploring that and would like to discuss that with us as a possibility to lead to a pilot facilitation, then by all means contact us. We are somewhat limited, and we like to coordinate everything with the appropriate entities at the state and also with the project officers and DSLR. But certainly we're interested in that if you have those type of opportunities at your level. And then Michael mentions for these national agreements, how do you envision that becoming operational with state and locals? So Michael, we realize there's always going to be some variability and some nuances from state to state, from local jurisdiction to local jurisdiction. And you can imagine with the corporate side of things, they don't want 3,000 different types of agreements. They'd like to have a standardized type of agreement. So we're trying to address and tackle some of those issues during the pilot so that the toolkit encompasses as standardized as it can be, the type of deliverables that are needed to make this agreement operational at your level. And then there will always probably be some nuances that have to be completed and whatnot at the various jurisdictional level. But if the big pieces of it have already been worked out, then it should really ease that process and make it something that's beneficial to everyone. So that's kind of our approach. And again, as we get towards the end of these pilots, we'll really kind of message a lot about that.
You did have an audio question from Adrian Donor.
Okay.
Can you hear me?
Yes. Hi, Adrian.
Oh, perfect. I am part of a couple of those pilots and think that working at the national level is a whole lot better than having us all do it individually. But I would like to see a couple of things happen about getting the information out that the pilots are happening, because there's the Portland metro jurisdiction is a huge closed pod jurisdiction, and so we're really looking at that higher level planning at this point. And the closed pod partner training was perfect. I'm not sure who all put that together, but we loved it. But almost had a fairly significant duplication of effort because we were looking at how do we do this as well, and didn't even know it was being worked on. And so as we talk about having a repository in the SharePoint site or something, having just an ongoing list of here are the pilots or here are the things being worked on might be very helpful, just to make sure that jurisdictions don't miss that message that they're being worked on and start poking at Walgreens or working on these pieces. Because I really do think that the efforts are better made at this more national level piece.
I think that's a great point, and I think that's something we probably are lacking right now. The MCM portal itself and all that it houses right now, from the RSS site survey to the new MCM ORR tool and all of this, we're really trying to drive traffic to be that central place of MCM references. And so I think the more things that we can have there that really provide that information to all of our state and local partners, the better. So yeah, we can definitely look at that. The one caution that I would have is, as we enter into a pilot and we have kind of a number that we're looking for, because this can get a little bit unwieldy and overwhelming if we have tons of jurisdictions participating at the same time, we really have to message that we're in the middle of this, and questions that may come up we can help address, but we also need to kind of see it through so that we, what we provide is on time and meaningful in that way. So we can definitely look at that from CDC, and Natalie and Claudia and I can talk about that with the MCM portal, but I think that's probably a great place to provide that kind of information.
Perfect. Thank you.
Thank you.
At this time, there are no further questions.
Okay. Well, for me, I'll just say, thank you so much for being a part of this. We know it's work that we've been doing for quite a long time across the country, and we're always looking at better ways to consolidate, share best practices, message, and some of the, from my perspective, some of these recent activities, such as I mentioned with Walgreens and Meals on Wheels, and the use of practicing this in concert with NACCHO and ASTHO, I think that it just really helps to ensure that as we're going through this, we're trying to be the most comprehensive and address all of the needs that exist there. And so I'm excited about the way we're organizing around this, as well as some of the other tools that have been described in the call today that are coming out to help. But certainly your feedback is always very, very helpful to us. So guys, are there any other kind of closing comments, Ray or Donna, Natalie, any of you that would like to say anything in closing?
Hi, this is Ray. I'll just say, always look to, if you guys want to share your resources or best practices or things that are might be innovative, please feel free to use NACCHO as a resource. We have our MCM toolkit listed there. It's always a great repository for new resources that have been developed or good information to get out. So we definitely see a need to promote various things that are going on, and we always are looking to promote good practices and resources that have been developed throughout the country. So,
Hi, this is Meredith, and on ASTHO's behalf, we've been really excited to be a part of this work with both NACCHO and CDC. And again, please make sure that states are sharing up with their regional reps on the steering committee for the EMCM steering committee with ASTHO, so that we can make sure that also, in addition to NACCHO, we're getting those state-to-state sharing sessions as well. Anything from Natalie, CDC, anyone else? Any final questions?
No, this is Donna. I just wanted to thank everyone for participating, and if you have thoughts or topics or things you think we may have overlooked or that we can address from the healthcare sector standpoint, feel free to email the email address that Adam had mentioned, or get it to Ray and he'll share it with us, or Meredith. Thank you.
Hi, this is Natalie. Nothing from me. Thank you.
Ladies and gentlemen, that does conclude today's webinar. We thank you for your participation and ask that you please disconnect your line.